We are here this morning to commemorate and recognize International Overdose Awareness Day. And as you look around, you can see the faces of the folks that we have lost to overdose. So we want to commemorate them and memorialize them this morning. And you can also see the flags over here that represent the lost lives. I would also encourage us to remember their light and brightness, their smiles, their countenance, the joy that they brought to your life and the community. I ask us not only to remember these individuals, but to advocate for the individuals with substance use disorders, to eliminate stigma, and to just be compassionate. It is important to realize that there remains work for us to do in order to save lives from this overdose crisis. We in the Office of Harm Reduction hope that because you're here, that you can stand with us as we continue to offer public health initiatives that are evidence-based, innovative, and nuanced in order to save lives.
We've worked very hard since 2014 to try to address this issue. We did reduce the number of deaths based on the great work that the Department of Health and others did. And unfortunately, it has grown as the public health crisis associated with opiate overdoses has morphed. It has changed. It is not the crisis it was 5 years ago. With the numbers that we're seeing in Erie County now, one person is dying on average per day as a result of an overdose. And those are numbers we have to reduce. If you use cocaine, if you use other street drugs, you should assume that it's laced with fentanyl. And if it's laced with fentanyl, you're basically playing Russian roulette. We offer assistance, we offer Narcan, we offer fentanyl test strips, we offer xylazine test strips to determine whether the drugs that you have are safe. And we want people to understand that's available for free, no questions asked. You can contact the Department of Health to receive those. But the only way to get through this crisis is to save as many lives as we can now and to address it by trying to reduce the number of individuals who actually use drugs in the first place. And that's what our team in the Harm Reduction Unit does. So I want to thank all of them for the work that they do, offer my deepest condolences to the families of those who've lost loved ones, and hopefully what they went through and coming out and speaking to the community about the loss that they unfortunately dealt with will reduce the number of deaths in the future so that no other families have to go through it.
This yearly display is one of our most visible and most important events related to harm reduction and opioid epidemic. We have about 350 memorials set up today, which represent just a fraction of all the overdoses that have occurred in our community. And for many of those, because of our work with families and with people who use drugs, we know the stories behind those lives and those losses as well. There's a reason why this event was designed in this way. And standing near all these signs, each one represents a staggering loss to a family right here in our community. And we need to remember these faces. We need to remember these names. We need to take every opportunity to support the people who are living in recovery and people who are using drugs and make sure that they're supportive and that they stay alive. Harm reduction is a core public health work, and we use that approach not just because it's basic humanity to treat people with dignity and preserve their health and safety however we can. We also use harm reduction because it's proven by science and our own experience to be very effective. And this is a very somber moment, and one that we're presenting with a sense of urgency and a feeling of hope. And there are far too many pictures here. In 2023, our county experienced the most overdoses it's ever recorded, 435 deaths. And that includes opioid-related and non-opioid related. And as at the end of August of 2024, this month, Erie County's lost about 270 residents to suspected or confirmed drug overdoses. So that's about, as the county executive said, 1 death per day. And this is now, so that we know this is not the time to be complacent. We need to continue to take action and move forward. And in the wake of all these losses, we have all come together to save the other families from these terrible losses. This is all about prevention. And we're also fortunate to have new tools available to us to prevent overdoses and death and provide support to individuals and other organizations in our community. So the opioid settlement funding that our county received does not begin to make up from all the catastrophic losses of life. But that funding will be able to pay for local initiatives that address the fundamental challenges that we see arise time and time again when we're working with people who use drugs and trying to see this entire scope of the opioid epidemic. Earlier this summer, we announced about $6 million in funding for community organizations with creative and constructive ideas around harm reduction, treatment, education, housing, and social support. So if you are here in person with us today at this press conference, you're likely to not need this reminder, but for people who are listening out there, we have to remember this, that overdoses can affect anyone in our community. There is nobody in our community that is immune from opioid overdoses or any drug overdoses at all. This can happen with regulated drugs or unregulated drugs. And we all know that unregulated drugs, including cocaine, including counterfeit pills, are all likely to be contaminated with fentanyl, which is potent and deadly. So if you did not buy your drug from a pharmacy, you have no idea what is in it. And you can just bet, if I were a betting man, I would bet that it had some level of fentanyl in it.
I want to turn it over to a key partner that we have with regards to fighting crime and getting these street drugs off the street, which is our district attorney's office. They have a unit that is focused on this to ensure that the individuals who are selling the stuff that often kills people are put behind bars. So with that, I'd like to introduce our acting district attorney, Michael Keane.
This is a problem that we've been dealing with in the district attorney's office with a number of our partners in government, including the Erie County Sheriff's Department, who really focus on trying to get drugs, especially drugs like fentanyl, off of our streets. We had a man who was in his 40s who thought he was buying cocaine, just like County Executive Poloncarz just pointed out. He thought he was buying cocaine and it was laced with fentanyl. The person that sold him those drugs knew that what she sold him was cocaine laced with fentanyl. He was dead in moments. But this man did not have an opioid addiction. He died because he was poisoned. He was poisoned by someone that didn't care whether she was selling him cocaine or cocaine laced with fentanyl. And the reason I point that out is because it's important that our legislature in the state government now gets on board with recognizing this to be what it is, which is it's poison. And the statutes need to be changed. There's a statute that we are proposing and the DA's offices across the state are going to be advocating for that is going to change our ability to prosecute these drug dealers that are selling drugs that contain fentanyl. We'll be able to prosecute them for the homicide that they caused, knowing that they sold a drug that contained fentanyl. So we're going to continue to push because while it's really important that we have days like today and we recognize the victims, it's about time that we started, taking additional steps to prosecute the people that are responsible for peddling these drugs. So thank you again, County Executive Poloncarz and all of our partners, Dr. Burstein, for shining light on this problem. We're going to continue to do what we do in the Erie County District Attorney's Office to prosecute the people responsible for putting these drugs on the street.
The gentleman that District Attorney Keane was speaking about, my family knows personally. So with that being said, every overdose is somebody. We need to treat people with dignity and respect. We need to give people the opportunity to understand that substance use disorder is not a choice, it's a disease. This is a celebration of life. As somber as the day is, it gives us an opportunity to reflect on the life that our loved ones lived before they succumbed to opioid overdose. I appreciate the opportunity for being here today, and I want to leave you with this. Every overdose is somebody. Thank you.
So we want to thank you all for being here this morning. Thank you for, as DA Keane said, shining a light on overdose and its prevalence in our community and across the country. So thank you.